Hey guys, welcome back to my channel in the Safe Zone. Tonight, my commentary will be on ADHD. It is not just for kids. By the way, hit that like button, share the video for me if you will. If you're not subscribed to my channel, please do so if you like what you see and hear over here in the Safe Zone. Just to let you know, this is a pre-recorded video. What is ADHD? ADHD is one of the most common psychiatric conditions. ADHD is commonly defined as a childhood onset neurodevelopmental condition characterized by a persistent pattern of inattention and or hyperactivity, impulsiveness that interferes with functioning or development. It often carries on into adulthood. Now, guys, most people think that ADHD is a childhood disorder. This could be the furthest from the truth, okay? This could be the furthest of the truth. Look at those percentages. 65% of undiagnosed children continue to have ADHD as adults. There are three commonly diagnosed types of ADHD. Predominantly inattentive, which is difficulty paying attention, forgetfulness, or easily distracted. Predominantly hyperactive impulsive type, which is fidgeting, talkative, and impatient behavior. Combined is inattentive and hyperactive impulsive ADHD. When you're showing symptoms of both predominant inattentive and predominant hyperactive and impulsive. Combined simply means you are displaying symptoms of both. If there is a family history of ADHD, this increases your risk. The exact cause of ADHD is still unknown, guys. While environmental factors such as low birth rate, delivery complications, exposure to toxins have been identified as potential causes, the biggest factor is genetics. You have an estimated 75 to 90% chance of having ADHD if a member of your family has it. ADHD into adulthood means ADHD is a 24/7 disorder that often sticks around into adulthood. Can you outgrow ADHD? It's one of the main questions that I get. However, it is widely accepted that ADHD is more common than previously thought. Up to 65% of patients with childhood ADHD continue to have difficulties well into their adulthood. Did you know ADHD is now recognized as one of the most common psychiatric diagnoses in adults, with a prevalence of approximately 5% in the US? That's about roughly 10 million diagnosed adults. ADHD symptoms often look different in an adult than it does in a child. While the symptoms of ADHD are the same throughout your life, they look different as you move into your adulthood. Most adults with ADHD are less likely to exhibit obvious hyperactive impulsive symptoms. It is often more on the inattentive symptoms side instead, especially when you look at it in adult females. Many adults with ADHD remain undiagnosed. Just because you weren't diagnosed as a kid doesn't mean you don't have ADHD. Sometimes ADHD symptoms are overlooked in childhood, leading to a misdiagnosis. Knowing what symptoms to look for as an adult is key. Do any of the following sound familiar to you? I'm going to read a list of symptoms of both types of ADHD. Do any of these symptoms sound familiar to you? The first set of symptoms that I'm going to talk about is ADHD symptoms of inattention in adults. You make careless mistakes. Do you have difficulty with detail, overlooking or missing mistakes at work, or do you often get lost in the details? Focusing. Do you find it hard to focus doing work and conversations while reading something rather lengthy? Are you a poor listener? Are you often perceived as someone who doesn't pay attention in conversations, even without any obvious types of distractions? Following direction. Do you find that you fail to complete tasks at work or at home? Or do you tend to start a task and become easily distracted or sidetracked? Staying organized. Do you struggle to stay organized at work or at home? Is time management or missing deadlines an issue for you? Sustained interest. Do you struggle with tasks that require continued mental effort, like completing forms or reviewing lengthy documents? Do you sometimes avoid these tasks or find that you will hyper focus on the wrong task? Misplacing items. Do you often forget or misplace items of importance like your phone, your wallet, or your keys? Are you easily distracted? Does your mind wander or drift to unrelated thoughts? Do you often find you have multiple thoughts at once or jump from thought to thought spontaneously? Are you forgetful? Do you often forget to get back to people or miss a bill or an appointment? Now, I know you guys are saying that most people deal with some of this type of stuff. Yeah, that may be true. But when we're talking about ADHD symptoms, this is constant. This is all the time. Okay? I want to make that little disclaimer in there. All right? Okay. The second set of ADHD symptoms are of hyperactivity and impulsive behavior. Okay. This starts with, are you fidgety? Are you often tapping your hands or your feet or finding yourself unable to sit still? Staying seated. Do you often find yourself wandering around when you should be at your desk in a meeting or seated at a social event? Restlessness. Are you excessive in movement or feelings of restlessness as an issue in your day to day? Is it hard for you to relax or do you struggle with sleep? Being quiet. Is it hard for you to quietly engage in leisure activities? Staying still. Are you often impulsive on the go, finding uncomfortable to be still for an extended period of time at work or in a social setting like a movie? Have you ever been described as hard to keep up with? Talkative. Do you find yourself talking excessively or too loudly at times? Interrupting. Do you sometimes blurt out an answer before a question is even completed or find yourself finishing other people's sentences? Waiting your turn. Do you struggle with waiting in line or waiting for your turn at something? Intruding on others. Do you ever interrupt conversations or find yourself taking over what others are doing without asking? Do you do these things impulsively? Okay. Now, when it comes to the combined type, which is the combination of both the ADHD of inattention in adults and ADHD hyperactivity and impulsive, do you show symptoms of both inattentive ADHD and hyperactive impulsive ADHD? ADHD can impact men and women differently. It looks different on a man than it does on a woman. The severity of hyperactive impulsive symptoms tends to be lower in women than in men. ADHD in men often looks more like the childhood symptoms. They're fidgeting, they're restless, they're risk takers. In women, however, it will more often show signs of inattention, which can be harder to spot, which can lead to being undiagnosed. Many girls and women remain undiagnosed, and as a result, they go undertreated. Even in adulthood, women are more likely to be underdiagnosed because their ADHD symptoms can be overlooked and chalked up to just being disorganized, distracted, overwhelmed, or lack of motivation. Women with ADHD are more likely to report depressive symptoms, anxiety, stress, and lower self-esteem, which have similar symptoms to ADHD, which leads to, like I said, being underdiagnosed or not diagnosed. What'll happen most times is this woman feels like she's going through depression or anxiety instead of, having full symptoms of ADHD because they're so similar. How much do you know about ADHD in women? Common coexisting disorders can delay or confuse a diagnosis. Mood disorder, tics, or involuntary actions, anxiety, substance abuse, and eating disorders are often accompanied by ADHD. Sleep issues. Not only are sleep disturbances common in ADHD, but they can be a sign of ADHD. Masking or overcompensating for symptoms is more common in women. For example, a busy mother ignoring her own symptoms in favor of caring for her children or others, that's a sign of masking or overcompensating. Self-reflection can help you see your ADHD more clearly. Talk to your friends and family about your symptoms for a more productive conversation with your doctor. In addition to reporting your symptoms when possible, doctors will speak with people who know you well in helping assess your symptoms and reaching an accurate ADHD diagnosis. ADHD can have a significant impact on your life. This is very important right here, guys. When adult ADHD goes unchecked or undiagnosed, there can be serious, dire consequences. ADHD impacts executive function. This includes a control over your working memory, your ability to self-monitor, self-control, and manage your time. Adult ADHD often includes a wider spectrum of emotional dysregulation and functional impairment. I'm going to talk about emotional dysregulation first. This is a term used to describe an inability to regulate your emotions and the responses to those emotions. It's estimated to be found in 34 to 70% of adults with ADHD. Emotional dysregulation can involve mood swings or severe depression and lead to high risk behaviors or impulsive behavior. The second one is functional impairment. This is a term used to describe having a hard time performing simple everyday activities, a difficulty working or keeping a job because of your symptoms. ADHD treatment can help improve these symptoms. Untreated ADHD can lead to work and financial issues. This includes, but not limited to, frequent job changes, loss of employment, productivity issues, disorganization, lower income, less motivation to engage and follow up on important tasks. Untreated ADHD can lead to relationship and social life strain. Symptoms can interfere with finding and maintaining social relationships, marital problems, increased risky behavior. Mental health and well-being struggles include low self-esteem, which can delay personal growth, increased antisocial acts, avoiding seeking help due to the social stigmas of ADHD, and more substance abuse, suicide risk, and psychological and mood disturbances. More substance abuse, suicide risk, psychological, and mood disturbances. If you think you have ADHD or your current treatment isn't working, you have options. Talk to your doctor, talk to your therapist, talk to your psychologist, talk to your psychiatrist. You have options. Key takeaways from tonight's commentary. ADHD is a 24/7 disorder that often sticks around well into your adulthood. Many adults with ADHD remain undiagnosed. And lastly, when adult ADHD goes unchecked or untreated or undiagnosed, there can be serious consequences. When adult ADHD goes unchecked, undiagnosed, untreated, there can be serious consequences. If you feel you are suffering from any of these symptoms, please don't hesitate. to visit your primary care doctor, your therapist, your counselor, your psychiatrist, or your psychologist. ADHD can be treated in adults. This concludes my commentary on tonight's subject of ADHD. It is not just for kids. Thank you for taking the time to listen to the video. Please like and share the video if you would. It's free. It does not cost a thing. If you're not subscribed to In the Safe Zone, please do so if you like what you hear and see over here. Tonight, I want to say, please have a very blessed rest of your night. And most of all, stay positive and stay productive. Thank you for tuning in on tonight's video. And I will see you in the next live or the next video. Until the next time, guys.